I guess I had the pleasure of saying that I started Iowa Specialty Surgeons, and the idea really was to have a group of independent surgical practitioners that were serving the community.
Iowa Specialty Surgeons is comprised of 3 different surgeons. I do plastic surgery, which is cosmetic and reconstructive surgery, and then my 2 partners are general surgeons.
We've been in practice for about 2 years now, and we focus on customer service, having real interactions with people so that we're present for patients all the time.
In our office, we use ChartLogic for everything. It's both our electronic health record as well as our billing system and sort of our scheduling and back office system. We don't use anything else.
We've been using ChartLogic ever since we've been in practice, and it's always been a fantastic medical record for us. As surgeons, we're using EMRs in lots of different hospital settings, and I think that ChartLogic is one of the best.
Probably the most important aspect of the software, what we really want to do is meet the customer's needs. They made it very clear is that they didn't want it to be complex. And so even though we have a scalability in our software and we have a multitude of features that they can either use or not use, they wanted to start out simply.
I like to draw out where I inject patients, so that way I always remember. I can review it with the patient to make sure they liked where I injected it last time. And I'm able to make the document in Paint, and then I upload it into the system, so it's always right there in the patient's chart.
One of the things I like about ChartLogic is the customizable templates. Get them the way you want them, minimizing the amount of extra work you have to do to complete a patient visit.
Everything is really nicely organized so we can get to it quick, and instead of hunting down stuff that's already been done in an EMR, we can spend that time with patients talking about what their goals are and trying to meet those goals.
I think the best part about ChartLogic is the RCM, the billing part, because we were basically a free clinic. All of the billing gets out and it gets out correctly. I can go in and I can write a doctor note in a second. We can go in, find out any information with ease. This system and the support that was offered to me just made it so easy to do. If it wasn't for them, we would not be a practice right now.
It's been very beneficial for us.